Hello everyone. This is a checklist for anesthesia interns. They need to connect IV fluids. They need to check whether arm boards are connected or not, and they also need to check the level of the table because according to the level and the position of the patient, the anesthesia spread varies. And also we need to connect BP cuff, saturation probe. Also we need to refill fluids if they are done, and we need to write anesthesia notes. I observed in my hospital most of the times they are giving bupivacaine as spinal anesthesia, and also we need to enter the operated cases and register. Also, we need to put ET plasters and cannula plasters pre-ready. So I got rotated in anesthesia department for 2 weeks, and the cases which I saw, like I saw external hemorrhoids, and I saw ENT surgery, and like before surgery they did intubation because it is general anesthesia, and for that they gave propofol, midazolam, succinylcholine, sevoflurane. Now let us know what these drugs are. So propofol is a short-acting intravenous anesthetic. It is also used as sedative. It can be used both for induction of anesthesia and also for maintaining general anesthesia. One thing to remember about propofol is it may decrease BP, so it may cause hypotension. In anesthesia interns need to monitor continuously patient until surgery is done. So they need to record pre-op vitals and also post-op vitals. So during surgery, if blood pressure drops, we can use vasopressor drugs like ephedrine, phenylephrine, and norepinephrine to increase blood pressure. So next drug is midazolam. It is a short-acting hypnotic sedative drug. It is also anxiolytic. We know like people who come for surgery are already anxious. So if we give midazolam, it will decrease their anxiety, and it is also a muscle relaxant and also anticonvulsant sedative drug. Next one is succinylcholine. It is a short-acting depolarizing neuromuscular blocking agent. So it's used mainly for muscle relaxation, especially before intubation. So remember, succinylcholine we use it mostly for general anesthesia, not for spinal anesthesia. We don't need any intubation, but always remember, I like heard it from my seniors that they always keep a backup plan ready for if spinal anesthesia fails suddenly in between surgeries. So next comes sevoflurane. It is an inhalation anesthetic used for induction and also maintenance of general anesthesia. Both it can be used in adults and children. And one more thing is sevoflurane is cardiostable anesthetic inhalant drug. So next I did duty in anesthesia. It's like on-call duty. Whenever surgeries come, they'll call us and we need to go. So I saw appendectomy, total thyroidectomy. Diagnosis is multiple goiter. So for multiple goiter, we did total thyroidectomy. So all these cases I saw in surgery. Actually, there are different OTs: surgery, EA, orthopedics, gynec. So in surgery OT, I saw these cases. Post-auricular sebaceous cyst I saw in ENT, and in obs and gynae. That's what I said, like we give bupivacaine, that is 2 cc. 2 cc means 2 into 5. We need to into multiply 5. We get 10 mg of bupivacaine. The same dosage given for all lower cesarean section operations. And they give oxytocin 10 units. And in orthopedics, I saw this Elizarov technique. And I saw fissure in ano fistulectomy surgery in surgery ward again. So I covered all wards for 3 days each: ortho, ENT, surgery, and gynec. So again the same surgeries: LSCS, DNC, tubectomy, inguinal hernia, hemorrhoids. In ortho again I saw K-wire, intertrochanteric hip fracture, humerus fracture. In OBG I saw some other interesting surgery. So whatever the surgeries, the drugs are same in anesthesia. For general anesthesia, need to do intubation, and for like spinal anesthesia, we need to use spinal needle and give anesthesia around T6 or T8. Actually, it varies according to the person. I remember in gynec they are giving around T6. One more thing, after giving anesthesia, we need to carefully observe the patient whether that anesthesia got spread or not. We use some like needles to prick on their stomach or the area where we want to give anesthesia. If they still didn't feel any pain or they're not feeling any cold like sensation, actually we use spirit soaked uh, to test whether they're feeling cold or not. These are the anesthetic drugs which are used for pediatric age group ENT surgery, that is that post auricular sebaceous. So before that, these are all the anesthetic drugs they are given. They are calculated according to the age because it is pediatric age group. So every drug into 10, that is the age of the patient, 10 kg. So drug into 10 kg. Here atropine is for, it is used to reduce saliva and fluid in respiratory tract during surgery. Also in emergencies we can use it to treat a slow heartbeat. Zofar to control nausea and vomitings. Midas already discussed as anxiolytic. Glyco means glycopyrrolate injection. It is also used to decrease mouth, throat, stomach secretions during like surgery or before surgery, and also it prevents heart rhythm problems during anesthesia, intubation, or during surgery. It also prevents reflex bradycardia during surgical procedures. Next, nalbuphine. It is narcotic analgesics, that is for pain medicine. It is used to relieve moderate to severe pain before or after surgery, or you can add it with any other general anesthesia before an operation. So, Butram is also for pain relief. Propofol already discussed for induction and maintenance of anesthesia. So ketamine is NMDA receptor antagonist. It is also used as analgesics and also used for depression or pain management. So scoline is nothing but succinylcholine used for endotracheal intubation. Next is atracurium. It is used for endotracheal intubation and also skeletal muscle relaxation during surgery. It is non-depolarizing neuromuscular agent, blocking agent. PCM for pain. Hydrocortisone, it's a synthetic glucocorticoid. It is used primarily to manage adrenal insufficiency or to reduce post-operative shivering. Neo is neostigmine. It is used to enhance neuromuscular recovery from non-depolarizing muscle relaxants, especially in general anesthesia. Glyco already discussed before to reduce saliva and stomach or like all the secretions. So these are the newborn babies I saw in gynecology. I felt so happy for seeing them first time. And this is placenta previa.